Hi, my name is Homa Jamaluddin. I have a master's degree in geriatric nursing and have passed the CBT test. During my studies, there were many exams, but unfortunately, the answers to some tests were wrong. After studying a lot, I prepared this video with 100% correct answers, which are all intended for international nurses and nursing students as well as their midwives who want to participate in the CBT exam in England.
Q1. Mrs. Smith developed an MRSA bacteremia from her abdominal wound and her son is blaming the staff. It has been highlighted during your ward clinical governance meeting because it has been reported as a serious incident, SI. SI is best defined as any incident or occurrence that has the potential to cause harm and/or has caused harm to a person or persons. B. A consequence of an intervention relating to a piece of equipment and/or as a consequence of the working environment. C. Incident requiring investigation that occurred in relation to NHS-funded services and care resulting in unexpected or avoidable death, permanent harm. D. All. Q2. A client had fractured hand and being cared at home requiring analgesia. The medication was prescribed under PGD. Which of the following statements are correct relating to this? A. The PGD can be delegated to student nurse who can administer medication with supervision. B. PGDs cannot be delegated to anyone. C. This type of prescription is not made under PGD. D. This can be delegated to another RN who can administer in view of a competent person. Q3. A patient on your ward complains that her heart is racing and you find that the pulse is too fast to manually palpate. What would your actions be? A. Shout for help and run to collect the crash trolley. B. Ask the patient to calm down and check her most recent set of bloods and fluid balance. C. A full set of observations, blood pressure, respiratory rate, oxygen saturation, and temperature. It is essential to perform a 12-lead ECG. The patient should then be reviewed by the doctor. D. Check baseline observations and refer to the cardiology team. Q4. As a nurse, the people in your care must be able to trust you with their health and well-being. In order to justify that trust, you must not A. Work with others to protect and promote the health and well-being of those in your care. B. Provide a high standard of practice and care when required. C. Always act lawfully, whether those laws relate to your professional practice or personal life. D. Be personally accountable for actions and omissions in your practice. Q5. Consent is best defined as A. Obtaining consent is a process and is a one-off event. B. Valid consent must be given by a competent person, who may be a person lawfully appointed on behalf of the person, and must be given voluntarily. C. Another person can give consent for an adult who has the capacity to consent. D. The assessment as to whether an adult lacks the capacity to consent or not is primarily down to the clinician providing the treatment or care, but nurses and midwives have no responsibility to participate in discussions about this assessment. Q6. One of your patient in a Bay 1 is having episodes of vomiting in the last 2 days now. The norovirus alert has been enforced. The other patients looked concerned that he may spread infection. What is your next action on this situation? A. Seek the infection control nurse's advice regarding isolation. B. Give the patient antiemetic to control the vomiting. C. Offer the patient a lot of drinks to rehydrated. D. Tell the other patients that vomiting will not cause infection to others. Q7. Mr. Jones' carers approach you to express their dissatisfaction with the care he is receiving whilst under your care. How will you best approach this situation? A. Explain to them that evidence should be made explicit to move the case forward. B. Tell them to put their complaint forward to the nurse in charge or sister of the ward. C. Advise them to speak to the police if a case needs to be filed. D. Apologize to them and reassure that their concerns will be dealt with in accordance to policy. Q8. All of the staff nurses on duty noticed that a newly hired staff nurse has been selective of her tasks. All of them thought that she has a limited knowledge of the procedures. What should the manager do in this situation? A. Reprimand the new staff nurse in front of everyone that what she is doing is unacceptable. B. Call the new nurse and talk to her privately. Ask how the manager can be of help to improve her situation. C. Ignore the incident and just continue with what she was doing. D. Assign someone to guide the new staff nurse until she is competent in doing her tasks. Q9. Why is it essential to humidify oxygen used during respiratory therapy? A. Oxygen is a very hot gas, so if humidification isn't used, the oxygen will burn the respiratory tract and cause considerable pain for the patient when they breathe. B. Oxygen is a dry gas which can cause evaporation of water from the respiratory tract and lead to thickened mucus in the airways, reduction of the movement of cilia, and increased susceptibility to respiratory infection. C. Humidification cleans the oxygen as it is administered to ensure it is free from any aerobic pathogens before it is inhaled by the patient. D. Humidifying oxygen adds hydrogen to it, which makes it easier for oxygen to be absorbed to the blood in the lungs. This means the cells that need it for intracellular function have their needs met in a more timely manner. Q10. You can delegate medication administration to a student if A. The student was assessed as competent. B. Only under close, direct supervision. C. The patient has only oral medication. Q11. A patient recently admitted to hospital, requesting to self-administer the medication, has been assessed for suitability at level 2. This means that A. The registrant is responsible for the safe storage of the medicinal products and the supervision of the administration process, ensuring the patient understands the medicinal product being administered. B. The patient accepts full responsibility for the storage and administration of the medicinal products. C. None of the above. Q12. John, 25-year-old, was admitted at medical assessment unit because of urine infection. During your assessment, he admitted using cannabis under prescription for his migraine and still have some in his bag. What is your best reply to him about the cannabis? A. Cannabis is a Class C drug under the UK Misuse of Drugs Act 1971. B. A custodial sentence of 28 days is now given to anyone in possession 3 times or more. C. Cannabis is a Class B drug under the UK Misuse of Drugs Act 1971. D. Possession of cannabis will incur a penalty of 3 months imprisonment with £2,000 fine. Q13. You are the named nurse of Colin admitted at respiratory ward because of chest infection. He also suffers from Parkinson's syndrome. What medications will you ensure Colin has taken on regular time to control his shaking? A. Cocaraldopa, Simet. B. Coamoxiclav, Augmentin. C. Cocodamol. D. Q10. Q14. One busy day on your shift, a manager told you that all washes should be done by 10 a.m. What would you do? A. Follow the manager and ensure that everything is done on time. B. Talk to the manager and tell her that the quality of care will be compromised if washes are rushed. C. Ignore the manager and just continue with what you are doing. D. Provide a written statement of the incident. Q15. What do you have to consider if you are obtaining a consent from the patient? A. Understanding. B. Capacity. C. Intellect. D. Patient's condition. Q16. Recommended preoperative fasting times are A. 2 to 4 hours. B. 6 to 12 hours. C. 12 to 14 hours. Q17. A nurse is not allowing the client to go to bed without finishing her meal. What is your action as a RN? A. Do nothing as client has to finish her meal, which is important for her health. B. Challenge the situation immediately as this is related to dignity of the patient and raise your concern. C. Do nothing as patient is not under your care. D. Wait until the situation is over and speak to the client on what she wants to do. Q18. A client expressed concern regarding the confidentiality of her medical information. The nurse assures the client that the nurse maintains client confidentiality by A. Sharing the information with all members of the healthcare team. B. Limiting discussion about clients to the group room and hallways. C. Summarizing the information the client provides during assessments and documenting this summary in the chart. D. Explaining the exact limits of confidentiality in the exchanges between the client and the nurse. Q19. During busy shift, a nurse loads medication and asks you to administer it. What is your action? A. Ask student nurse to help you administer medication. B. Ask another staff nurse to help you with administering medication. C. Accept to administer the medication. D. Refuse to administer the medication. Q20. What to teach a young patient when he is taking antibiotics? A. Take it during morning and complete the dose. B. Don't take it with alcohol. C. Take it with food or after meal and complete dose. D. Medication may cause hypertension. Q21. A patient with burns is given anesthesia using 50% oxygen and 50% nitrous oxide to reduce pain during dressing. How long this gas is to be inhaled to be more effective? A. 30 seconds. B. 60 seconds. C. 1 to 2 minutes. D. 3 to 5 minutes. Q22. All but one are nursing teachings for patients taking allopurinol. A. Instruct patient to drink plenty of water. B. Educate patient that he may experience these side effects: nausea, vomiting, loss of appetite, drowsiness. C. Encourage patient to report unusual bleeding or bruising, fever, chills, gout attack, numbness or tingling, flank pain, skin rash. D. Instruct patient to chew medication. Q23. What is the purpose of the code? A. It outlines specific tasks or clinical procedures. B. It ascertains in detail a nurse's or midwife's clinical expertise. C. It is a tool for educating prospective nurses and midwives. Q24. A 37-year-old woman presented in accident and emergency accompanied by her husband due to swollen wrist. On your assessment, you noticed some bruises over the arm upon rolling her sleeves. She looks reserved and only replies to your questions in short answers. When her husband left to see their children, she becomes extremely nervous and showing signs of restlessness. You suspected some safeguarding issues, but she would not give much information when probed. What will be your next appropriate action? A. Make a safeguarding referral on behalf of the woman and her children as you suspect domestic violence. B. Inform nurse in charge about your suspicion and refer when appropriate. C. Alert the police on the safety of the woman's children. D. Refer the husband to the Council for Social Work assessment and investigation on suspicion of violence against women and children. Q25. What angle to inject via subcutaneous route? 90, 45, 60, 15. Q26. You are caring for a patient in isolation with suspected Clostridium difficile. What are the essential key actions to prevent the spread of infection? A. Regular hand hygiene and the promotion of the infection prevention link nurse role. B. Encourage the doctors to wear gloves and aprons, to be bare below the elbow and to wash hands with alcohol hand rub. Ask for cleaning to be increased with soap-based products. C. Ask the infection prevention team to review the patient's medication chart and provide regular teaching sessions on the 5 moments of hand hygiene. Provide the patient and family with adequate information. D. Review antimicrobials daily. Wash hands with soap and water before and after each contact with the patient. Ask for enhanced cleaning with chlorine-based products and use gloves and aprons when disposing of body fluids. Q27. The NMC code expects nurses to safeguarding the health and well-being of the public through the use of best available evidence in practice. Which of the following nursing actions will ensure this? A. Using isopropyl alcohol 70% to wipe skin prior to cannulation. B. Suggesting healthcare products or services that are still trialed. C. Ensure that the use of complementary or alternative therapies is safe and in the best interests of those in your care. D. All. Q28. Registrants must only supply and administer medicinal products in accordance with one or more of the following processes, except A. Carer-specific direction, CSD. B. Patient Medicines Administration Chart, may be called Medicines Administration Record MAR. C. Patient Group Direction, PGD. D. Medicines Act Exemption. Q29. Mental Capacity Act 2005 explores which of the following concepts? A. Mental capacity, advanced treatment decisions, and the Act's Code of Practice. B. Mental capacity, independent mental capacity advocates, and the Act's Code of Practice. C. Mental capacity, advanced treatment decisions, independent mental capacity advocates, and the Act's Code of Practice. D. Mental capacity and the possible ethical and legal dilemmas in its interpretation. Q30. You are transcribing medications from prescription chart to a discharge letter. Before sending this letter, what action must be taken? A registrant should sign this letter. B. Transcribing is not allowed in any circumstances. C. The letter has to be checked by a nurse in charge. D. Letter can be sent directly to the patient after transcribing. Q31. As a nurse, you are responsible for looking after patients' nutritional needs and to maintain good weight during hospitalization. How would you achieve this? A. Providing all clients with liquid nutritional supplements. B. Assessing all patients using MUST screening tool and by taking patients' preferences into consideration. C. Checking daily weight and documenting. D. Assessing nutritional status, client preferences and needs, making individual food choices available, checking daily weight and documentation. Q32. One of your patient has challenged your recent practice of administering a subcutaneous low molecular weight heparin, LMWH, without disinfecting the injection site. The guidelines for nursing procedures do not recommend this method. Which of the following response will support your action? A. We were taught during our training not to do so as it is not based on evidence. B. Our guidelines, which are based on current evidence, recommends a non-disinfection method of subcutaneous injection. C. I am glad you called my attention. I will disinfect your injection site next time to ensure your safety and peace of mind. D. Disinfecting the site for subcutaneous injection is a thing of the past. We are in an evidence-based practice now. Q33. Barbara's friend Colin is inquiring about her condition over the phone. As her named nurse, you will keep confidentiality by A. Providing him with the information he needs. B. Asking him to speak to Barbara's relative for information. C. Gaining Barbara's consent to provide him information. D. Asking Barbara to speak to him. Q34. You are the sign-off mentor of Ben, a third-year nursing student. Your ward is his last clinical area placement. When caring for a patient with diarrhea who uses the commode, you will expect him to A. Use alcohol gel to clean his hands before and after care. B. Wash his hands with soap and water before and after care. C. Clean the commode with soap and water. D. Clean the commode with triclosan solution. Q35. When delegating any task to anyone, what must you consider? A. Delegating according to job description. B. Delegating tasks to student nurses they can be able to do. C. Delegating tasks only to healthcare assistants. D. Before delegating tasks to anyone, have to make sure that person is competent and able to carry the task. Q36. Gurgling sound from airway in a post-operative client indicates what? A. Complete obstruction of lower airway. B. Partial obstruction of upper airway. C. Common sign of a post-operative patient. D. Indicates immediate insertion of laryngeal airway. Q37. Your patient has been prescribed tramadol 50 mgs tablet for pain relief. Upon receipt of the tablets from the pharmacist, you will A. Record this in the controlled drug register book with the pharmacist witnessing. B. Put it in the patient's medicine pod. C. Store it in ward medicine cupboard. D. Ask the pharmacist to give it to the patient. Q38. Steve was admitted to your ward after sustaining a head injury following a fight with another fan during a football match. One of the police officer has asked you if he can access his medical records. You will A. Allow the police officer to read through his medical notes. B. Ask the police officer to obtain a warrant. C. Refer the police officer to the nurse in charge. D. Ask the police officer to seek the patient's consent. Q39. What infection control steps should not be taken in a patient with diarrhea caused by Clostridium difficile? A. Isolation of the patient. B. All staff must wear aprons and gloves while attending the patient. C. All staff will be required to wash their hands before and after contact with the patient, their bed linen and soiled items. D. Oral administration of metronidazole, vancomycin, fidexamycin may be required. E. None of the above.
Please don't forget like and subscribe. Thank you.